I served as a chairside dental assistant for nearly 15 years. Throughout my journey, I gleaned valuable knowledge from various dentists and assistants. And now I feel so compelled to impart my wisdom and dental expertise to support others on their path. So please glove up and join me, Ruby Jones, your favorite dental diva, as we strive to enhance ourselves together. This is the moment that Dr. Akinyemi proposed for tooth number 28 that has that extensive distal decay to be extracted.
In the front?
Yes, it is.
He's gonna use the bathroom.
You can take the
So she just did his blood pressure.
Yeah.
He's about to go to the bathroom.
All right.
Welcome back for part 2.
You do all of them. So you gotta come every
You gotta
appointment.
get an extraction. Open. Down here. So this one, we're extracting this one today. And we'll be back to get those root tips later. We are getting 28 extracted. Feel that decay on the distal, like it is into the nerve. And she is setting up back there for her. All right, y'all, so we got our topical gel, the numbing gel. She's gonna use that curfew with a short needle. Probably because she's not doing a block injection. She's probably gonna numb right beside that premolar. But we got our basic setup here. Explore your mouth mirrors, straight elevators, Minnesota retractor. We got our periosteo elevator, periosteo, the spoon excavator or curette, and that is a bone. Can you guys see that? That's the bone file. Bone file. Dean scissors, hemostat. Okay, I can remember. I think this is a 212. What is it? I forgot the name of this instrument. I think it's a 212, y'all. But it is for teeth that are not molars because it helps grab it. Grab the crown of the tooth as best as possible. So that's the instruments. Oh, we got our suction, surgical suction. Saliva ejector, air and water. Not too bad.
I'm gonna fix this.
That's where the money's at.
Yep. He works from home too.
Wow.
Living a life. It gets to do with the boys. I have 2 boys. I have a 7 and a 9-year-old.
Oh, wow.
Yep, fun ages. So they are in 4th grade and 1st grade. Big pinch right here, okay? Nice difference, nice difference, nice difference.
Just keep breathing out your nose.
We may need to give you more. I know. We may need to give you more because of that abscess, because it takes longer for anesthetic to kick in.
Hold on, Dad.
Okay. You know what I'm gonna do? I'm actually gonna give him my glove.
So yes, you guys, even though he has been on an antibiotic for a few days, almost a week now, from the urgent care, if you heard the doctor earlier, the infection level is so high, it's gonna be a little bit more difficult to get him numb. Okay, so she started off giving him an infiltrated injection, which is an injection right beside the tooth. That wasn't enough for him. So the second injection she gave him was actually a block injection to get to that mandibular canal nerve to numb the entire fourth quadrant. Okay, and so he was having some issues getting numb. He was getting numb, but it was still causing pain. It was still causing pain because the level of infection was just so high. So she, which I loved, made sure that he was very comfortable throughout the entire procedure. So the first instrument she used was the periosteo elevator, which separated the ligaments from the gum tissue to the tooth. Now she has moved on to the straight elevator. So as you guys learn in class, or if you don't know, the elevator elevates the tooth. It is lifting the tooth up and out from the socket. Okay, so an extraction, you don't just start with the forceps and just yank the tooth out of there. You slowly but surely have to work the tooth away from the ligaments and filaments that it's attached to. And then you are working it slowly but surely up out of the socket. So this is exactly what she's using the straight elevator for. Once they elevate the tooth enough, now we can move on to the forceps. So like I was saying, this forceps, the bird beak, I can't exactly remember the specific name for it, but it is perfect for premolars or anterior teeth because it grabs, as you can see, the crown perfectly, and we got that baby out of there. So at this point, you can see the assistant grabbing the tooth with the forceps and holding that surgical suction very close to collect that very infected blood. She's actually trying to squeeze out any infection or abscess left over. She's going to use this curette or this spoon style instrument to scoop and scrape out any infection that may be down at the apical region. So that's what's happening now. Okay, so this is Paradex, which is the solution that is going to just clean and disinfect that socket before we finish up here. So she's just irrigating the area, just cleaning it and disinfecting it as much as possible. The dental assistant is staying very close with that surgical suction to make sure that they're collecting as much as possible to lower the discomfort for the patient having to swallow all of that. And here is the gauze, a 2x2 gauze that we fold up as good as possible so that the patient can apply pressure and stop the bleeding. Good job. He had a good experience, and it was a great straightforward extraction, which I love, which he loves. Right. Thank you. Wait a second. Oh my goodness. That's the decay right there. Ah. Remember, once the decay communicates directly with the nerve, like this situation, once the decay is extensive and it touches the nerve, it is considered irreversible pulpitis, meaning there is nothing we can do outside of, first, a root canal to save the tooth. If the patient doesn't want to save the tooth, they would extract it. Okay, or of course, the last option is do nothing, but those are the options. So you have to do the gauze, let me see. The gauze. How you feeling?
All right, good.
Wasn't that bad? You still numb?
Yeah. Still numb, but wasn't pain.
Whew. Good luck. Okay, y'all. So hopefully you took the time to watch parts 1 and 2 videos of going to the dentist with my dad. And so the first part, I just wanted to do a recap. It was just the visit itself. We actually was greeted by a dental assistant that
is a graduate of DA Academy, which makes my entire heart melt every time I take my kids or my family members or myself to a dental office and the assistants are actually one of our own. That just it makes my heart melt, because it's just living proof that the program works, that this 12-week short program actually works. Like, the proof is in the pudding, you guys. So anyway, she I don't think I got this on camera, but she was saying that she was working at a surgeon oral surgery office for over 2 years, and there she actually was just doing sterilization and infection control. So she said for her it was very boring. She said, well, I was just in a room and kind of was cleaning up after the surgeries and flipping rooms, sterilizing rooms, preparing it for the next treatment of the day. And she said here and there that she would assist with treatments, but for the most part she was flipping rooms, which is what we kind of call a sterile tech or a floater, which means your focus is not going to be sitting chair-side treatment, but you're going to be more so paying attention to the flow of the office. You're paying attention to when the hygienist is done, when the dental assistant and the doctor is done. You're jumping in there and flipping the room very thoroughly and quickly, efficiently. And so now, fast forward, she wanted to get more clinical, more chair side, and that is why she has been working at this office for the last 7 months. And so yes, she graduated from our program as a DA1. She worked her way to become a DA2. I'll be seeing her again, so I would like maybe for her to share some her testimony or her experience. And I wonder if she has the other certifications like nitrous oxide, corona polishing, just things like that. I would be interested to find out. But back to what I was saying, she greeted us back. She briefed with us. So she talked to my dad and myself about why we were there, and explained to us, like, even though we are there for an overall visit, that they would be addressing the area of concern, which is what is most likely how it would go. Because if somebody's coming to you in pain, you want to address the pain, the hot spot, for the patient, to get them out of discomfort, to get the infection out of their body and just start the healing process, right? So she did the briefing, then she did her x-rays. She did the panoramic x-rays, and she also did as many periapical x-rays as she could in the mouth, because my dad, as you guys see, and I'll put a picture right here, he doesn't have he's missing a lot of posterior teeth, like a lot. And the remaining posterior and anterior teeth that he does have is extremely worn down, to where I'm surprised. I want to say he had some fillings on them before, and they're covered with some type of bonding something, because if you just look at that, you would think that it's extremely painful. Like, there's a lot of dentin exposure, and he has worn out that amalgam layer. Like, it's done for, okay? But basically, she did the x-rays, and then the doctor came in and did an exam. After talking to us, she was so sweet, amazingly sweet, and she actually recognized me from our school page, and she knows a lot of my graduates and my previous students. So she was extremely sweet and thorough and patient and just clear when it came to her exam. So her exam was definitely comprehensive, which I can appreciate that for my dad. So basically her treatment plan was, let's address the tooth in question. So we were able to extract. She thought, because it was so badly decayed, you guys seen that picture, I'll put it here as well, because it was so badly decayed, she anticipated it to be a surgical extraction. Surgical extraction is going to be a more invasive extraction. It's not the ordinary, simple, straightforward, or easy. None of this is easy, but the easier extractions. And so sorry you guys, safety first. So she did she did treatment plan for a surgical extraction, but when she did the extraction, it was actually pretty simple. So she just used some elevators to break the periodontal elevator to break the ligaments away from the tooth. And that's where you guys will see that my dad could not feel it, so he was numb when she did that part. But as soon as she hit another part of the tooth to elevate it even more, he claimed that he was feeling pain, and so she stopped and gave him more anesthetic. And then she gave him time to get profoundly numb, and she was able to start and complete the extraction. And so that was nice of her, because not only is it less time and work on her end, so it's a very non-invasive, it's not a hard or difficult extraction. It was simple. And so she changed that in the computer, which costs less. So a simple extraction is going to be less cost involved versus a surgical extractions cost more, which makes sense. You know, it's harder to get out, it's more time, it's a little bit more difficult of an extraction, so it makes perfect sense. But she was so sweet. She updated the treatment plan reflecting that it was a simple extraction today on 28. And so that's what we did. So we're going to start there, addressing the tooth that's causing the pain. And then his second phase is going to be returning for additional extractions. So the other two teeth, central incisors 24 and 25, and also that root tip that we could barely see on the x-rays. We could barely see it, but my dad was like touching his gums, so I know he could feel it, but I couldn't to the eye. I couldn't really see it, or even with the x-rays I couldn't really see it, but the doctor did pick up on that through her clinical exam. So we'll be back for phase 2 to get the remaining extractions done. There was a root tip on the maxillary. I'm not looking at the treatment plan, but there was like 1 or 2 that he needed to extract on the maxillary. So basically phase 1 is going to be extractions, and then we move on to the deep cleaning. She actually said his pockets weren't that bad. She felt like they were kind of deep on the upper left, but for the most part she just thinks he needs like a debridement and I don't want to say a regular cleaning, because he's basically borderline, but she did say it's not going to be a full-blown deep scaling root planning situation. So extractions first, then the cleaning, stabilize his gum health, and at that point we should be able to get some impressions done to get his partials. So she's recommending maxillary and mandibular partials to close out his treatment plan. Okay, so I plan to bring you guys along with me. Again, just trying to love and support my dad. He has been through a lot in his lifetime, but he's just hard-headed. Like a lot of people, like a lot of men, just like a lot of humans, we can all be very, put ourselves last and not do what we're supposed to do for ourselves. But that apparently is not a good thing, because things like this happen if you allow it to fester. But we're going to be positive, and we're going to be solution-based thinkers, and we're just going to be glad that he started his journey. Again, we are not here to judge. So I don't want to, because on one side I'm kind of, feeling bad or looking at it like, Ruby, what could you have done? Like, why would you let this get that far? But again, this is a whole nother adult, you guys. So you can't make anybody do, whether it's your husband, wife, spouse, parent, adult parents, like we can't make anybody do, siblings, you can't make anybody do what they do not want to do. So don't give yourself or anybody else a hard time. Just focus on the plan in front of us in the future. And so again, I'm expecting greatness. I love this doctor. I love this very brand new office. I love that there's a graduate there assisting and helping this doctor with all of the chairside treatments and all of that. So it's an amazing, like legit 11, 12 out of 10. I give her more than the 5 stars. Vibrant dental, I think it was. But I'm gonna shout them out properly. I'll give you guys that information. But yeah, so this was just to recap what was done in videos 1 and videos 2. And if you guys have any questions, let's talk about it. If you want to ask about anything you saw in the video, or anything that I mentioned through the me narrating the recaps, please let me know, because that's how you grow, that's how I grow, that's how we grow, you know, that's how we learn. And so thank you for watching. Let me know if you have any questions. Y'all have an amazing day.